Hi, and welcome everyone from the Hank Conference. I hope everyone's having fun so far. I want to put together this just informal video. My name is Tim Hirsch. I've worked with Zion Health since the beginning, and I work as our relationship manager, and I'll be manning the booth here. So definitely love to network with you and chat with you. We have an Amazon gift card giveaway. But I wanted to do this video as, again, very informal, just I think a perspective from DPCs that sometimes gets missed when they're looking at health sharing. I think that a lot of DPCs see value in the financial side of it, but I think there's a lot more to it. Zion Health is really built with DPC in mind, and I think that there is a lot that goes along there with that adds some value to talking to your patients about Zion Health. So I like this slide because we talk about the foundations of a successful DPC practice. And, the business side of it, I know is new to a lot of DPCs, and that's, a tricky thing. I mean, there's a lot of, even just the compliance side of things. I know that's a headache, and obviously the practice itself. I mean, that's why you went to school for so long and worked so hard. And that's really probably why you're in it. But this third bullet point, the health advocate side, I think is something that is so important to the success of a DPC and keeping members for a long time. When I see DPCs do this well, I get such incredible feedback from their patients that will never leave them. Because this is just another level of being mindful about the fact that people are coming from such a broken system that they need help when it comes to finding medications, finding affordable procedures, and finding something that's more affordable than traditional health insurance for a lot of people. I think this all goes together in being a health advocate for your patients. So just real quick, I think most DPCs know this. I mean, Healthshare is a lower cost alternative to traditional health insurance. It's not a fit for everyone. But it's a community of like-minded people sharing one another's medical bills, medical expenses. It's funny, and I always love hearing this from people once they take the time, they do their due diligence, this seems too good to be true. They usually come up and say by the end of it, this is what I thought insurance was or should be like. And I think to a lot of people, that is what health sharing is. It's the solution that they've been looking for that they didn't know existed, which is really neat. It's nice to be on that side. So when we talk about reasons, and reasons may be out of the scope of what we normally think, why would I talk to my patients about health sharing? That's a lot of time, effort on my part. That's not talking about their health specifically. But, when it comes to running a business, people who can afford your membership, is going to help with your retention. Not only the retention from being able to afford it, but the fact that we are providing mutually beneficial education to patients to become better healthcare consumers. Same thing you're teaching your patients, we're trying to teach our members as well. And when we can align that education, we create a member and a patient that is going to be a better consumer of healthcare, more likely to stay with your DPC practice and more likely to stay with Zion Health. There's such a togetherness between that if we do it correctly, that is going to be success for everyone here involved, including the patient and the member. Because education is a huge part of this that it's almost ongoing forever. I mean, it's just going to constantly be there. And if we can help navigate that with you, that's a true partnership in my eyes. So some of the things that patients will just say, this might be triggered in your mind, like when you hear like, hey, we're healthy, we need something just in case big stuff. As a DPC practice, I mean, how do you answer that question? That's not what the DPC is there for. It's here to prevent the big stuff, but an accident's only so preventable. So they're going to have that concern. And how are you going to talk to them about that? We're tired of paying for health insurance we never use. We're not getting a subsidy. We see alternative medical providers. We want to stay out of that insurance system. Those types of things should, trigger something in your brain to say, hey, maybe I'm going to point them in the direction of Zion Health. Maybe I want to be the expert. Maybe you do want to have those in-depth conversations. But to leave this stuff unsaid or unanswered, I think we're missing being the health advocate part of being a DPC practice. So who's a good fit? We have an incredible maternity program. If you're not aware of that, ask me about that in the booth. Our maternity program is bar none even compared to health insurance plans out there. We work with small employers, on a daily basis. At least once a day, I'm navigating a conversation with a direct primary care practice and an employer. An employer is going to have a concern for everything that's out of the scope of a DPC practice. You got to be able to answer that question. And when we can answer it together and edify one another, it really starts to solidify that business in that it's a no-brainer for employers. If we talk to them correctly and they see the savings, this is a no-brainer. Pre-Medicare retirees, just because health insurance becomes so expensive in people's 50s and 60s. And then what I know is a huge segment of business for DPC practices, and definitely us, is self-employed individuals. Definitely some savviness oftentimes that comes with that, and looking at things in an alternative way. So I'd love to stoke some conversation about any of this. Please visit in the booth. Any questions or anything on this that we can help with to be able to deliver better healthcare advocacy to your patients and our members. We're all ears and we love those conversations. So enjoy the HIMT conference and we'll see you out there.